We're looking at 40 years of treating patients really the same way, and about 30% or so of those patients don't respond to that treatment, and those are, as our clinical collaborator Mitchell Sabloff says, those are the worst of the worst patients. And so we've identified a drug that at least in mice, does treat those patients. We've identified biomarkers which will identify those sick patients at diagnosis who would benefit from this drug. The drug's not yet clinically approved, but we hope to be in a clinical trial in the next year or two with that, so we'll be able to test it in patients. The patients that we're actually targeting with this drug are truly the sickest of the sick, and even bone marrow transplants generally don't help those patients. Having grown up in a family where I have a brother who has a developmental disability, I was always drawn to science. I didn't want to become a clinician. I didn't want to have any patients die on me. So I felt, what I could do would really be in science at the bench. And starting during my postdoctoral fellowship, when my fellowship was sponsored by a family that had lost their daughter to cancer, it started me thinking more and more about the potential of our research to benefit people, and it's kind of come full circle now, 7 years ago, moving to Ottawa, to the Ottawa Hospital Research Institute, to work with clinicians to try to take our basic science discoveries and move them to the clinic.